Hey guys, it's the Doc, and here's our next installment of the hashtag #AskDrMudgil series of posts. This one comes in from Reddit. It comes in with a picture, which we will show you. And the question starts as a statement, Rash. Is this heat rash? I've never seen a heat rash that looks like scratch marks. No scratching was involved. The rash just appeared this way. Well, that's a good question. So as I always say, your first best step is getting in to see a local board certified dermatologist who can take a look at you, let you know what they see, and perhaps give you a diagnosis and some therapeutic options. If you're in the New York City area, you can come see the doc. I'll be happy to help you out. But if you're not, I'm sure you can find a wonderful dermatologist wherever it is that you reside. Now, let's get into it. So it looks like here, based on the picture alone, that you have something called dermatographism. So you may not have scratched this area, but it looks like there's all these sort of linear configurations of swelling in your skin, of what's called urticarial or hive appearing lesions, and a sort of background of just red, or erythema as we call it. So typically that indicates something called dermatographism. You may have actually rubbed, or something may have rubbed up against your upper back, and it caused like a hive where the skin was rubbed. So typically we do see this when someone scratches their skin, and if they have something called dermatographism, they get a sort of welt in from the scratch itself. So sometimes when I'm testing a patient who's describing dermatographism, and this is something I think every dermatologist does, you'll kind of use your nail or something that's a little bit sharp-ish, and you'll make a tic-tac-toe symbol on someone's back, and then you wait 20 seconds, and then you see that whoosh, it's just this welt that has a tic-tac-toe morphology, and so that's what's going on here. Now, typically what that indicates is that something has stimulated your immune system and elevated the level of histamine in your system. So classic things are like bugs, a bug bite could certainly do it, but something infectious like a virus or a bacterial infection, drugs, so if you started a new medication or a supplement, that sometimes can do it, or foods. If you have a food sensitivity or a newly developed food sensitivity, sometimes that could do it as well. I mean, there's a million other things that can cause hypersensitivity rather. But like I said, taking it full circle, your next step is to get in to see a board certified dermatologist. They can do some blood work, perhaps some other testing to try to elucidate what might be causing this dermatographism in you, and also give you some therapeutic options to help you get better. Hope that answers your question. Let's get it.